Hello students, let's do this question today. So after a point mutation, glutamate replaced by valine, which leads to the formation of sickle cell hemoglobin. We know that this is the mutation of the point mutation of sickle cell anemia. So mobility of HbS, that is sickle cell hemoglobin, as compared to normal hemoglobin on gel electrophoresis will be decreased or increased or dependent on the concentration of sickle cell anemia or unchanged. What is the answer? So let's compare HbA, the normal hemoglobin, which has glutamate. On the other hand, we have HbS, sickle cell hemoglobin, which has valine. Now, glutamate has charge. It has negative charge. It's a charged amino acid, but valine is non-polar. There's no charge in valine. So when just one replacement is done, only one amino acid is changed. So HbS, can I say HbS has less charge, right? Question they're asking is the mobility means movement in electrophoresis. Now we already know that movement in electrophoresis depends mainly on charge. Charge is the main factor on which electrophoresis movement depends, right? So less charge means less movement, so movement will be decreased. Answer is decreased. Bye bye, best of luck, keep solving more questions.